Before the pandemic, Helen walked her dog here for 5 miles every day. But now, all she can manage is 5 minutes.
It's the heart and the lungs. If I do something like that, I would be back in bed solid for a week. Even brushing my teeth or stirring a pan that I'm cooking, my heart rate can go up to 120.
Breathlessness is just one of the many symptoms Helen's experienced since contracting coronavirus way back in March. She had a fever for 7 weeks straight and has now developed cognitive problems, which means she's unable to work or drive. And there's still no end in sight.
Everybody's saying live in the day and live in the moment. It's very hard to live happily in the moment with no hope. Because at the moment I haven't got any hope. Because you can't keep having that hope and that hope being dashed. That's the hardest thing.
It's thought 1 in 5 people with coronavirus have symptoms for longer than 4 weeks. For 1 in 10, they last longer than 12 weeks. Symptoms can be anything from brain fog and anxiety to kidney problems and fatigue. Those varying symptoms have made long COVID a difficult diagnosis for GPs to make, but it's hoped that'll now change following the publication of the first official guidance on how to manage the disease.
It's a new condition, so clinicians like me have not had very much experience of being able to deal with it, and these guidelines are a very helpful way of enabling us to provide the best possible care for our patients.
The guidance will be continuously updated as more evidence is gathered from new specialist clinics. Chelsea and Westminster Hospital is one of 69 across England that's now taking referrals for long COVID patients and offering them multidisciplinary treatment in a move welcomed by campaigners.
We hope that this will now spell the end of people being dismissed by their doctors, being told that they're suffering from anxiety and being unable to get the treatment they need.
We're all members of a club no one wanted to join.
It's thought there could be as many as 500,000 people suffering from long COVID in the UK, and while their numbers continue to grow, they now at least have somewhere to turn. Ivor Bennett, Sky News.